Ebola. The killer virus. Ebola is a deadly African virus ravaging across the globe, for which no known medicine or vaccine is available. To have a peek into the history of this epidemic. In August 26, 1976, in Yambuku, a town in the north of Zaire, a 44-year-old school teacher returned from a small hike feeling very sick. A week later, he had uncontrolled vomiting, bloody diarrhea, trouble in breathing and bleeding from his nose, mouth, and anus. He died 14 days after the onset of symptoms. This was the starting of an epidemic that killed 280 of the 313 infected persons. The epidemic was then named Ebola after the river Ebola, which runs through Congo in Central Africa, where the epidemic was first reported. The Ebola virus belongs to the Odaminonge virus of the family Filoviridae. 4 subtypes of the Ebola virus have been identified. Ebola Zaire, Ebola Sudan, Ebola Ivory Coast, which affects human beings, and Ebola Western, which affects primates and non-primates. Just like the AIDS virus, the Ebola virus also is transmitted through unsterilized needles, unhygienic hospital conditions, and personal contact, like even a handshake. This is an airborne disease, but the organism which carries it naturally, without being infected, has not been identified. The virus affects humans, gorilla, chimpanzees, and monkeys. Just like the AIDS virus, the Ebola virus also is transmitted through unsterilized needles, unhygienic hospital conditions, and personal contact, like even a handshake. This is an airborne disease, but the organism which carries it naturally, without being infected, has not been identified. The virus affects humans, gorilla, chimpanzees, and monkeys. The onset of this African hemorrhagic illness is abrupt, and it comes in suddenly without notice. The incubation period of the virus is 2 to 21 days. The infections are acute and mostly deadly. The Ebola virus enters the bloodstream through the skin, membranes, or through open wounds. The virus docks with the cell membrane, and the viral Na is released into the cytoplasm of the cell, and new viral proteins are produced. The new viral genomes with rapid protein coats are now ready to infect the other cells of the body. The virus now targets the small capillary vessels of our body and attaches to their walls. The walls are so affected that it causes leakage of blood and serum into the surrounding tissues. When white blood cells of the body attack the virus, they dissolve, releasing a chemical into the bloodstream. This chemical signals the release of other chemicals like pro-inflammatory cytokines, procoagulants, and anticoagulants. These injure the blood vessels even more, resulting in permanent bleeding, which is even worse. Eventually, the entire body starts leaking and dissolving. The first symptoms of Ebola hemorrhagic fever are severe headache, weakness, and muscle aches. As the disease progresses, the person experiences severe vomiting, abdominal pain, diarrhea, pharyngitis, conjunctivitis, and external bleeding. The body temperature becomes very high, so that fever and chillness set in. The pathway of Ebola virus to the human body is said to start with problems relating to the upper part of the body, from way up the head. The first symptoms begin from day 7 to day 9. On day 10, fever sets in along with vomiting. On day 11, bleeding starts from the nose, mouth, and the anus. And after day 12, the person loses consciousness, and there is also massive internal injury and bleeding. Eventually, the diseased person dies. Early diagnosis is very difficult in the case of Ebola, as the signs and symptoms of this disease are very similar to other infections. But laboratory tests like PCR and ELISA can be carried out at the later stages to detect the virus. It is indeed discouraging that no standard treatment is available for Ebola. Patients can only be given supportive therapy like treating infections which accompany the disease, balancing their body fluids and electrolytes, and also maintaining oxygen status and blood pressure. As there are no medicines for this killer virus, it is extremely important that everyone, including children, are made aware of how to best avoid being infected by Ebola. It is important to avoid physical contact with people with signs and symptoms of this hemorrhagic fever. Do not forget to wash your hands many times a day with soap and water. Avoid shaking hands with people. Instead, a fist bump would be the best. Keep away from fruit bats, monkeys, and dead animals, as they can be carriers of the virus. Cook food very well, and it would be safer to avoid bushmeat. After the death of an Ebola patient, it is scary that the virus would still be contagious in the body fluids for many days to come. Hence, burial should be done with extreme caution. Care should be taken in handling and transporting the dead body or remains. Please make it sure that cultural practices or religious belief do not hinder in incinerating the body, as well as all things associated with it. Because incineration is the only way of ascertaining that the virus has been destroyed. Formally, scientists announced that they have successfully vaccinated monkeys against the deadly Ebola virus. But the Ebola vaccine which they prepared was based on the 1976 strain of Zaire species of Ebola, which cannot protect us from the two species that affect human beings. As there are no medicines or vaccines for this disease, it is vital to educate everyone around about the preventive measures that need to be taken to save mankind from this killer virus. This video was issued in public interest.